Senators are starting their work on their version of the health care bill this week, with Majority Leader Mitch McConnell taking over the reins. Many say that they will be digging deeper into the impact on voters. I'm joined right now by Senator Bill Cassidy. He's a Republican from Louisiana and a medical doctor who sits on the Finance and Health Committee. Senator, good to see you. Thanks so much for joining us.
Maria, thank you for having me.
So I know that you're working on your own act and have been for a long time in terms of the health care bill. Let me ask you, are you planning to rewrite this bill, start from scratch, or add to it?
So the bill that we put forward, the Patient Freedom Act, it's known as the Cassidy-Collins, actually achieves President Trump's goals that he said in the campaign. And those goals were to make sure people had coverage, care for those with pre-existing conditions without mandates, and to lower premiums. Now, if the House bill doesn't accomplish that, we don't have a score yet, I'll continue to push the Patient Freedom Act, the Cassidy-Collins plan, because it does achieve the president's goals.
When will you have a score on the House bill? Why do you think that perhaps the House bill doesn't achieve those things?
If you look at the first iteration, 24 million people, it was scored as losing insurance. Now, you could say the CBO overscored that. But let's just say 9 million people lost their insurance. It also said that premiums rose by 20% in the first year relative to Obamacare, and Obamacare premiums are going up 40 to 50% per year. So it would be 20% on top of that. So it clearly didn't achieve President Trump's pledge, his contract, if you will, with the voter. And so I'm basing on that previous score. We have to wait for the next score.
So are you expecting the kind of fight that we just saw take place in the House, a similar situation in the Senate?
I don't know. As long as the president's contract with the United States, which is those 4 things, and I added something to it called the Jimmy Kimmel test. You can lower premiums with a really lousy policy, which when someone gets sick, they suddenly realize it only gives them $50,000 worth of coverage, but they now have liver failure or heart failure or a car wreck, and they need more. So if you also make sure that folks have the coverage that is adequate, and the president very much has supported that concept, as has Mick Mulvaney, his OMB director, then I think we come up with a product. And the product, I think, will end up looking somewhat like Cassidy-Collins. I've thought about it for 7 or 8 years. I'm a physician, worked in a hospital for the uninsured, taking care of folks. I kind of get it. You give power back to the patient, lower premiums, it works. If the House plan doesn't do it, we'll push our own.
So how does the Cassidy-Collins Act and the Cassidy-Collins bill differ specifically when it comes to pre-existing conditions to the Houses?
So the way you really need to lower premiums is by expanding the risk pool. So if you have a few sick people and they're in a risk pool or a group of people insured of 50,000 strong, the cost of the few is spread out over the many. If you look at a Fortune 500 company, that's how all of them manage their illness. So our plan actually expands the number insured, fulfilling Trump's pledge on that, by the way, by allowing states to enroll folks who are eligible unless they don't want to be enrolled. And you do that, you get a bigger risk pool. And instead of being older and sicker like the Obamacare risk pools or premiums climbing every year, it is actually younger and healthier, and therefore the cost of the few is spread among the many. That's a key difference, and ours is more actuarially sound. Ours has been proven by experience with, again, every Fortune 500 company that manages its own health care.
Especially since you've been working on this for 7 years and you have a real feeling about what could work and what won't work. But let me ask you this. What's your timing on this? I mean, are you expecting this to be, weeks drawn out? I mean, we all know that you've got a lot on the agenda, not just health care reform, but then tax reform expected to come soon after. Are you going to be able to get that done this year?
I hope so. It's really important. Obamacare premiums continue to climb. Insurers keep pulling out of markets. I'd love to have some cooperation from the Democratic Party, which so far they've not cooperated at all, because it's important. Whether it's a blue state or a red state, these insurance markets are escalating in cost and in some cases imploding. So we'd like to get it done this year. If the other side decides not to help, it makes it harder.
But don't you know that they're not going to help? I mean, don't we know that already? We've heard everything from Chuck Schumer calling this administration the swamp cabinet to Elizabeth Warren saying people are going to die. I mean, we know that they're not going to be there. So what's the plan B then?
Let me start off as my perspective as a physician. And I had patients, as I look back, some would have voted for Obama, some would have voted for Trump, but they were my patients. This is not a Democratic issue, it's not a Republican issue. If a senator looks at his or her state and sees that the insurance market is collapsing and that there's counties without any insurer at all, and they only come back in if premiums are allowed to rise 100%, hopefully that senator will look beyond partisan politics and say, this is not Democrat, this is not Republican, this is about our patient. And if you look at Trump's goals that he enunciated in the campaign, his contract with the voter, that's something that we should all be able to endorse, no matter your party. Hopefully, patience will take the precedent over party.
So you think that you'll be able to do health care and tax reform this year, then? When would you expect a health care bill on the president's desk?
Well, that's in some way related to, well, the CBO scores it, both the House bill and our bill, and the time it takes for us to get consensus, but I would guess sometime in the fall.
All right, we will leave it there. Senator, we'll be watching. We know you have a lot on the agenda.